I'm Jeremy Adams, Director of Community Outreach for At-Home Specialized Senior Care. Now we're going to talk about At-Home Specialized Senior Care, one of your free movie sponsors. We do the home health care, but we're a little bit different than Who's Your Home Care. You've already heard from Tammy. They specialize on the skilled side that makes therapies available, whereas we work with them very well and work up to that point on the skilled nursing side. So we're a little bit different, so I'll share a little bit about that as well. First of all, though, we're located in the Anderson area as our office, 130 West 8th Street in the downtown Anderson area. Our phone number is 765-621-2992, and you're going to be able to learn the kinds of things I'm going to share with you in the next couple minutes, as well as a lot more by visiting our website at staywellathome.net. That's an AT, not an at sign. So it's STAYWELLATHOME.net. You'll be able to find out everything about us, some of us that work in the office, and then what we're providing out in the community as well, helping our senior loved ones remain where they want to be, which is at home. So that's our part of the continuum of care. Even though we have some sponsors that are a part of our event that provide assistance on the other side of home, or when home becomes another place, nobody sits down with their family, their children, grandchildren, whoever it is that's helping them make those decisions, and says, you know what, guys, I think it's time for you to put me in a nursing home. I mean, those conversations just don't happen. I can't say that they've never happened, but obviously for reasons we all understand, they're not very common. You know, people want to remain home. They want to hold on to their independence as long as possible. And that's where we come in. We come in to help do just that. We want to make home a safe option longer. We want to make sure that more independence is being held on to for a longer period of time. And through some of our services, those things are very possible. So some of the ways that we're different is that we specialize in Medicaid and private pay for the most part. And we've got a lot of clients that need 24-hour care to be able to remain in their home. So we're there all the time. And then there are people who just need people to pop in, some of our nurses, some of our staff, to be able to pop in here and there throughout a day just to make sure that they're still safe. It makes home still very much a possible option for the right now. And we do some of those 24-hour care services all the way down to, 8 hours a week through different chronic disease managements. A lot of our clients have, diabetes, they've got Parkinson's, there's lung diseases, Alzheimer's, dementia are starting to really take a toll. Heart failure, some things relating to that, hypertension. Some of those diagnoses that some of our senior loved ones have received that are starting to take a toll on how they live. That doesn't mean, obviously, that life as you know it is over. It's not time to make some of those difficult phone calls to talk with family. It's independence is still very possible with those diagnoses. Sometimes you just need a little bit of help, and that's where we come into play. We come out and do medication setups, we're medication reminders, we're, some of the things that you're not able to do around the house anymore as safely as you used to be able to do, we can come out and do some of those things. Even some of your light housekeeping options, meal preparation, transportation even. So we're doing a lot of those services in the home or wherever they call home, and we work with, Tammy and Who's Your Home Care, who's already spoken. We work very well with them, so we're not a competitor. You may see the flyer and think that we do a lot of the same things. Our services complement each other very well. We're just not working with the Medicares, and we're not working with the therapies, but we're both working with the same goal to help you remain in your homes, hang on to your independence as long as possible. So I also want to touch on that question of when's the right time. We've asked all the movie sponsors for them to kind of share some tips and advice, and I've chimed in from time to time with some of them when we were interviewing, and I just want to echo some of those things. Unfortunately, decisions have to be made in a hurry a lot of times for families. They've got 24 hours, the hospital has shared some things with them that are changing the dynamics of how they live, and decisions have to be made quickly. So it's always best to just do some homework. Obviously, we're not a facility. You're not going to be able to come and take a tour, But it doesn't hurt to give us a call. You've got our information. Encourage some of your friends and family to do the same. They got information from our flyer. Give us a call. Ask some questions. Find out. It's never too soon. There may be some hours requirements that have to be met to be able to get a company involved. But as soon as you notice a senior loved one not able to do some of the things that they used to be able to do safely, as safe, then it's at the very least time to start asking questions and start looking into things. There's nothing wrong with that. You don't have to feel guilty. If anything else, you can feel good about the fact that you're going to be better prepared. I guarantee you that 24-hour window when you get it from a hospital or even a facility, while it's still going to be stressful and it still may pull on the heartstrings and it may be even heartbreaking at times, it's not going to be as stressful if you're already prepared for it. And you can do those things with the whole continuum of care, whether it be finding out about hospice, finding out about your long-term care options, your skilled nursing facilities that specialize in rehabilitating back to home, to then get a company like Who's Your Home Care and Tammy, who you've heard from, to come in and do something. And then once you're not needing the therapies anymore, or if you didn't need them at all, then you call us with at-home specialized senior care, and we're coming in to do some of those things that help keep home a safe option, help keep your senior loved ones out of the hospital from going back to the emergency room, which obviously is kind of a popular conversation if you're in the healthcare world, or if you watch much on the news, with some of the changes that are coming with different benefits and providers, those kinds of things. Obviously, if you've got a benefit that's taken care of, if you're calling me and you've got Medicaid, it's probably not appropriate to just say, you know what, I want some help cleaning up the apartment or the house. I'd like Medicaid to pay for it. It's obviously not going to work that way. We talked about those diagnoses in the beginning for a reason. Those are the things that are going to trigger the benefit. If you've got some things that are going on, or a loved one has some things going on that are causing you to need nurses to come out to provide some care, to need aides to come out and to be able to do some of those things around the house, that's what was going to qualify. So in our case, we're going to send a nurse out. She's going to do an assessment. She's going to spend some time finding out what's really going on. And then we're going to send a request in to whatever the insurance provider is, whether it be Medicaid, private insurance, or if you're paying privately, obviously we're still going to do those assessments and make sure it's something that you really need. We're not in the business from taking money from people who don't need to give it to us, because we know some of these elements of care can be very expensive, and we don't want to help exhaust what's available monetarily before it needs to be done. So we're in the business of doing the right thing. And that's another reason why you can trust these sponsors that we're putting in front of you today. They're chosen on purpose. They're good at what they do. We're not going to bring anybody in and to sponsor this event that you can't trust. So we want you to take these flyers that we're passing out that have our movie event dates on it and a little bit of information about all of us, so that you can help tell us apart. And you know what it is what it's like to go to a health fair and not be able to remember the difference between who gave you this pen and who gave you this stress ball. We want to avoid that. This isn't a cheap event. We're spending some time to invest in the community, and we want to do it wisely, and we want you to know the difference between us, who we are, what we do. So keep those flyers, put them on your refrigerator, put them on your nightstand, put them on the coffee table, or the table beside your favorite chair where you spend some time watching TV. So if you or someone that you know and love has something going on, you don't have to rattle your brain to try to remember who were those people again at that one event, or who were those dozens of companies at that one health fair. We want to avoid that situation. We want to help be a part of better preparing you to be able to handle things when it pops up for yourself or people that you know, because there's somebody on that flyer that can help you with just about anything that's going to pop up, and we want you to know that you can trust us. So give us a call. And if you don't know which one of us to call, by all means, none of us are going to care if you give us a call. I volunteer myself. Give me a call, and I'll make sure I put you in touch with the right one if it's not me. Also, if you're Facebook savvy, we want you to go to Facebook and look up At-Home Specialized Senior Care. Make sure you're following us. And then also go to the Community Connections Facebook page. Talks about bridging people, care, and possibilities. It's a program that we've put together that is sort of like these commercials that you've been watching before the movie that are going to better educate our communities about healthcare options, maybe some options that have something to do with aging in place that aren't necessarily healthcare related, but they do very much stress something along the lines of aging in place. And then also anything that we feel like your senior loved ones might find entertaining or just enjoyable to be a part of. We're going to be promoting it through that page. We're going to be doing lots of video projects. We're going to try to do our part in making sure we're better informing our community just to help with, especially that window, that 24-hour window when you're making decisions. We want to better equip. We want to be a part of the equipping process. And obviously we all like to have fun. This event today is going to be a blast. You're going to love the movie. They're always encouraging faith-based films. I know this is the first one that you're going to see, but you're going to love them. They're going to be fun. And so there'll be information like that out there as well. Again, I'm Jeremy Adams, Director of Community Outreach with At Home Specialized Senior Care, also the host of the Community Connection Show, Bridging People, Care, and Possibilities. And I hope you enjoy the show. This has been a Community Connections production, bridging people, care, and possibilities.